Hi, my name is Dr. Erica Baiden with Black Physicians of Utah.
And I'm Rachel Fuggins with Myriad Genetics.
In this video, we'd like to discuss colorectal cancer awareness. Colorectal cancer is the third most common diagnosed cancer in the United States. Rates of colon cancer are rising in young people and disproportionately affecting the Black community. Colon cancer is diagnosed at higher rates in Black people than any other ethnic group in the United States. Black people are 20% more likely to get colorectal cancer and 40% more likely to die from it. We don't completely understand the genetics around this, but we do know that there are socioeconomic, nutritional, and other barriers that contribute to this disparity. So what should we do?
Get screened.
Exactly. The American Cancer Society recommends that people of average risk begin colorectal cancer screening at age 45. Early detection can save your life. There are several tests available, but the colonoscopy is the gold standard. There are some signs and symptoms of colon cancer that we don't want you to miss. A lot of times these symptoms are so common in our day-to-day that people might put them aside and not want to get screened. So remember, not all rectal bleeding can be due to hemorrhoids. Other signs and symptoms of colon cancer can be a change in bowel movements, whether it's diarrhea or constipation or alternating between. Cramping abdominal pain may be a sign, sudden weakness, fatigue, and unexplained weight loss. Some risks of colorectal cancer include a family history, especially in a first-degree relative, a diet high in processed foods and processed meats, a diet that is low in fiber, smoking, or if you have a history of something called inflammatory bowel disease like Crohn's or ulcerative colitis. Also, if you've had prior cancer treatment that required radiation to your pelvis, you'll have an increased risk of colorectal cancer. Rachel, I just want to thank you so much for being here and recording with us.
Thank you for having me.
Yeah. And also thank you for sharing your story and the impact that it's had on your family. I understand your maternal uncle was diagnosed with colorectal cancer at the age of 52. Was this on routine screening or was this based on symptoms?
So it was based on symptoms. He actually didn't have his routine screening done at the age of 50. And when they found his cancer, it was stage 4. And he had other symptoms, abdominal swelling, rectal bleeding, all of the things that you kind of listed before. They had gotten to a point of where he's like, I now have to go to the doctor and I need to address these things because being Afro-Polynesian in Polynesian culture,
the stigma
around having any sort of physical ailment, especially for men, can make them feel that they could be seen as weak or, it's a hindrance, it's a burden to their family to have to take care of them. So he was a patriarchal figure in my mom's family and in his community. And so I think part of the reason why he waited so long to go to the doctor, even probably after the symptoms started, is because of those things. When really, had he gone sooner, it would have made him less of a life lost too soon for everyone, that he, his family, his community, and I just think that ignoring those things and waiting too long to go to see the doctor, it only has,
It doesn't just impact the person diagnosed, but the impact on family members.
Right, because it could have been caught at age 50, or, he could have had these symptoms prior to, needing that routine colonoscopy. It could have been age 48, 47, who knows? And
guidelines change now. So, you mentioned age 50 as routine. Actual guidelines state that age 45 is the recommended for screening. And I think your uncle, at the time that he passed, he just barely missed that guideline change.
He did. And so I think a few years after he had passed, and a few years after he passed, the routine guideline recommendation went down by 5 years. So I think that it's important to be aware that guidelines change constantly. Be a good historian of your family cancer history. Ask those questions. Hey, if you have relatives that are 45, it's okay to say, are you getting your routine colonoscopies? And if the conversation becomes, yes, I had polyps, okay. Polyps are precancerous. What does that mean? And I think it opens the dialogue for a lot of people, especially culturally when, health is a stigma that you don't necessarily talk about.
our people, our community are dying disproportionately from colorectal cancer and other health disparities. And so we want to empower our community with knowledge and action to be proactive rather than reactive about things. So that way we can affect our generations to come in a positive way.
Yeah, I agree. And I think that, knowing how to be proactive gives people the ability to take their health back into their own hands, and they're empowered to do more. They're empowered to talk to more relatives because they see that they are actually able to prevent preventable cancer and give themselves time back with those that they love, give their family members time back with those that they love, because there isn't this understanding that you just have to suffer alone, because, opening up that conversation too makes it a lot easier for someone to feel comfortable discussing those things with their provider, which is ultimately where...
And recognizing, screening is not a weakness. Being diagnosed is not a weakness. So share that. Let your community lift you up. Let your family lift you up. And then again, remembering that your voice, your sharing, and not keeping this diagnosis a secret is actually going to empower your family and support your family for generations and to come.
Yeah, I agree with that. And I think that, if there's any takeaways that I have, it's that, don't be afraid to ask questions to your providers or your family members. Don't be afraid to speak up when you have irregular symptoms. Don't be afraid to advocate for yourself.
And question.
And question, is there something in my family history that's off? If there's a lot of people with colon cancer, hey, this could be indicative that there's something else happening here too. And so what does that conversation look like with your provider? It's, advocating for yourself to be able to help prevent preventable cancer and educate those in your life.
Well, Rachel, that is, huge. I'm very grateful that you are here today to share this story. And I think the impact that you now have on your family is going to be incredible. So keep on your mom.
I do. I call her and I'm like, hey, how did your colonoscopy come back? And I think just even for her, right, knowing that there's another person in her family that's going to keep asking her, hey, are you making sure that everything's okay? And if it isn't, are you communicating that? Makes people feel more comfortable in sharing those things, whereas culturally that's not, instinctually what they want to do. That's not naturally where they go. But knowing that, hey, this could affect my daughter, this could affect my daughter's children.
Right.
I think just, yeah.
How many cousins do you have on your mom's side?
Cousins. So...
But siblings, biological, because we're going to talk about genetics now.
Yes. So on my mom's side, I would probably...
You know how we do things.
Yeah, exactly. Everyone's a cousin. So I would say, on my mom's side of the family, about 21.
Yeah.
So.
And are these things that you talk about with your cousins?
Not openly, no. I think it's more of a conversation of I'm telling my mom to tell her siblings, and then they tell their children, but at least there's someone that's starting the conversation of, hey, let me check in with my siblings and make sure they're doing the things that I'm doing, that my daughter is also making sure I'm doing. And it's a domino effect, right? Because you almost have a little bit of fear that your relatives are going to find out that you're not taking care of yourself. So you have to kind of be like,
pressure.
No, hey, I am. See, I don't want to end up being the person that is a life lost too soon for our family. So there's a little bit of that comes into play too.
Yeah. What steps have you taken personally to help reduce your risk?
So personally, I've taken a lot of steps, communicating with my providers and making the choice to not continue to see a provider if it feels like they're not affirming what my family history is and what my concerns are, what my symptoms may have been that I think might be linked to something that could cause colon cancer for me later down the line because of what I've seen in my own family and because I lost an uncle to late stage young colon cancer. And I think I'm just more aware of my body. I don't wait to go to the doctor.
Right.
Working at Myriad definitely opened my eyes to there's something that could be happening here that is hereditary. It could be something that not just myself, but everyone on my mom's side of the family needs to be aware of. So,
what steps are you taking nutritionally to help reduce your risk?
So I don't eat meat. I primarily eat a seafood-heavy, vegetarian-based diet because I know, one, digestively, I don't process meat well, but then I also know, based on my family cancer history and the symptoms that I've had, those things can exacerbate a lot of those issues for me, and so I just choose to eat healthier. I eat more fiber. I keep track of when I'm regularly going to the restroom.
Right.
Is something off? Because I think that's one of the earliest indications something is not right.
Change.
So those are kind of the steps that I take, and if I do notice anything abnormal, I notify my doctor.
Good. You don't wait.
Yeah, I don't wait.
Yes.
Don't wait.
Great. Well, I just want to thank you again. This was so lovely to have you here, and I appreciate your openness and vulnerability to share your story and the impact on your family.
Thank you.
Yes. March is Colorectal Cancer Awareness Month. Please get screened like we discussed. For more information, please go to
Myriad.com for information on hereditary cancer and what red flags might be in your family cancer history.
For other information, especially about providers, please go to bpou.org. Thank you.